So good afternoon, everyone. Again, thank you so much for being here. We appreciate your support. We will present today our second workshop that has been developed and organized by the Mental Health Task Force of the Engaging the Academy project. So today's workshop will focus on structural factors and mental health disparities, particularly in graduate and professional schools. So my name is Evelyn Vasquez, and I have the honor to be the academic lead of this project. So now I'm also going to present our co-presenter, Dr. Wen Chadur. So Wen, would you like to introduce yourself?
Yes, thank you, Evelyn. Hello, everyone. My name is Gwen Coder. I came into this project actually as a graduate student leader. I had been the president of the University of California Graduate and Professional Council, and now I have moved into post-grad life and am continuing to work with basic needs, which in the University of California also does include mental health and well-being. So it's an honor to be here. I believe very strongly in this project, and I'm happy to be continuing to support.
Thank you so much, Gwen. And also, Lisa, would you like to introduce briefly yourself?
Thank you. Good afternoon, everybody. My name is Lisa Molina, and I'm representing Solid Ground Wellness and Recovery. And we are an off-campus substance use treatment center. But we do provide services to the students of UCR for substance use needs. And this is our second project with PCORI, so I'm really excited about being invited back and in this second project as well. So thank you very much.
Thank you so much, Lisa. And so, well, we're going to start as well with the lang acknowledgement. So we at UCR would like to respectfully acknowledge and recognize our responsibility to the original and current caretakers of this land, water, and air, the Cahuilla, Tonpa, Luiseño, and Serrano peoples, and all of their ancestors and descendants, past, present, and future. Today, this meeting place is home to many indigenous people from all over the world, including UCR faculty, students, and staff, and we are grateful to have the opportunity to live and work on this homeland. So as Lisa mentioned, this project is funded through a Patient-Centered Outcomes Research Institute, also known as PCORI. And PCORI is an independent nonprofit organization authorized by Congress in 2010 to fund comparative effectiveness research that will provide patients, their caregivers, and clinicians with the evidence needed to make better informed health and healthcare decisions. So PCORI is committed to seeking input from a broad range of stakeholders to guide its work. So this project, as some of our members have mentioned before, it is a collaboration between UCR faculty, staff, and students, Solid Ground Wellness in Recovery, UCR Health, UCGPC, Healthy Campus Network, and again, this project, it is funded by PCORI. So also one of our mental health task force leaders is here, which is Dr. Kimberly Lake. Thank you so much for being here, Kimberly, as well. Well, we would like to start with one activity. So we would like to know from your perspective, what do you know about the social and structural determinants of health? So I'm going to pause a little bit here, and I'm going to open the responses so you can start sharing your ideas with us. So all these responses will be anonymous, so feel free to share anything you know. Remember that we don't have any right or wrong answer. We are here to learn from each other. So let's take a couple of seconds. Okay, we're getting some responses already, so thank you. I'm just going to share again the presentation. You can scan the QR code, or also you can use the voting code 4153-79-17. And I will also share the link in the chat.
Oh, I did that already for you.
Oh, okay. Thank you so much, Mike.
Of course.
Okay, thank you. Okay, so we have one answer. So let me see. If also the rest of the team can provide your feedback or your recommendations here. I'm sorry, my computer, it is a little bit slow today. So, okay. So here are some of the responses from the team. So someone said very little. Typically, one must be diagnosed to receive support. Racial discrimination and finances play a large role in seeking help. Health is about more than just our own choices. It is where we live and work. And also we have that can impact care needs, barriers, facilitators in access to care, effectiveness, appropriateness of care delivery, and care outcomes. Also, we have here that social and environmental factors that impact an individual or community's well-being. Thank you so much for sharing with us these incredible responses. So the goals of our talk today, it is to discuss how the academic environment and social and structural factors contribute to barriers to mental health services use among historically marginalized graduate and professional students. We will review and discuss findings from the Photovoice and the Healing the Academy projects, and at the end, Wen will guide us on some activities to reimagine mental health services in graduate and professional education. We also would like to remind you that you can always share any questions or any comments in the chat. Also, you can raise your hand, and we will also allow you to ask any questions or to make any of these comments whenever you would like to. And so now here we are. So social determinants of health. As some of you have mentioned before, so social determinants of health, or known as SDOH, are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life, outcomes, and risk. So you can see here, there is this image that was created by Healthy People's 2030. And you can see that they are highlighting 5 main social determinants of health. One, it is healthcare, access and quality. Another one is neighborhood and built environment, as well as social and community context, economic stability, and education access and quality. So I just would like also to point out that there are other scholars that they are highlighting even 7 social determinants of health, but this might vary from the approaches, but also from some of the disciplines where they are coming from. We are using specifically this one that was also promoted again in the Healthy People study. So when we start looking about the social determinants of mental health, so what do we mean? So these social determinants of health have been also highlighted by Compton and Shim in 2015 as these 4 main social determinants of health. So whenever someone has adversity, adversity experienced at all stages of life in its various forms, including poverty, structural violence, inequity, and resource deprivation, is a significant risk to mental health. So please just keep in mind these social determinants of health. So for whenever we were going to start our activities, then we would like to hear from your perspective, from your expertise, and also some of the recommendations you might have to move forward, or not to move forward, but also to decrease these barriers and increase the access so we can move forward with the main purpose of the project, which is increase the engagement and the capacity of diverse stakeholders to address the unmet needs of historical graduate and professional students. So we have here also that racial discrimination and social exclusion, also poor education, unemployment, and job insecurity, as well as poverty, income inequality, and neighborhood deprivation, poor housing quality, and housing instability, all these are also forms of adversity. And you might be thinking, well, many of these social determinants are actually experienced by graduate and professional students. And yeah, that is true. That is why also for us in our project, it is too important to bring these frameworks for us to move from mental health challenges at the individual level to move us to more to the social and to the structural level. So we can think or rethink mental health services from more liberatory approach. So when we are also talking about this liberatory approach, it is where all the voices are included, respected, and are also highlighted. So you are here as an expert. We want to hear your voices. So please share your concerns, share your questions with us again. So another key aspect that it is for our project, it is health equity. What it is health equity? Many of you might be familiar with this image to the right, that it is comparing very briefly what it is equality, right? Like we're giving the same, and versus what is equity. So we are giving specifically what each of the individuals or members of our communities need. So health equity is achieved when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. So health inequities are reflected in differences in length of life, quality of life, rates of disease, disability and death, severity of disease, as well as access to treatment. And again, this information was pulled out from the Centers for Disease and Control and Prevention. So then we'll move forward to another important aspect that we must recognize, which is white privilege. So I included here an image that when I just saw it on Twitter. So it says, you can't come in to discuss racism. It's whites only. You know, so we are seeing these white men talking to a man of color. But then you see they're just men, as if women or transgender people, they don't have room for also talk about issues of racism. So, and we see here that it is also very important. This supposedly it happens in a university, right? So they are talking white privilege retreat. So it's like we are in higher education sometimes confronting into these discourses, right? So it's like, yes, we're inclusive. Yes, we love representation, but then we look at who is making decisions, and mostly are men, and mostly of them are white and cis male. So white privilege is a system of unearned rights and benefits, and it upholds racism. So So all of our experiences take place within a context of power and privilege. So just think about the higher education system, but as well think about mental health services. So think about also these other powerful system that also operates from a white male privilege background. So all our experiences take place again within this context. So the advantages conferred by being white are unseen and unacknowledged. Every white person in this country has white privilege, whether they are aware of that privilege or not. So some examples of white privilege are being viewed as, by default, as competent, unthreatening, trustworthy, and worthy of respect, if there is nothing that suggests otherwise. And also we will be sharing as well the report where we also highlight this concept of white privilege with you as well. So whenever we are thinking again about racism and mental health, it's very important that we acknowledge and we name it as it is. It is, public health issue. Racism, it is a public health issue. And racism is a mental health issue because racism causes psychological trauma. So here are some of the statistics, that you can find in Mental Health America. So Black adults are 20% more likely to report serious psychological threats than white adults. So depression in Blacks and Hispanics is likely to be more persistent. Native and Indigenous Americans report higher rates of post-traumatic stress disorder as well as alcohol dependence than any other ethnic or racial group. First-generation immigrants, particularly from conflict areas, might experience trauma as well. So unfortunately, there has been seen as that among Latinos or Hispanic young adults, the suicidal dose have been rising. So the Latinx and Hispanic population, older adults and younger, are more susceptible to mental distress relating to immigration and acculturation as well. So what are some of the barriers to mental health care? So just keep in mind that these are the barriers for everyone, like let's say like mostly all racial or ethnic groups that have been included in statistics. I'm saying this because not all statistics are representing all the voices. So I am a qualitative person. Also, I am a community-based researcher. So please also keep in mind my own bias about these statistics and numbers. So whenever we're talking about barriers, we know that financial, lack of insurance coverage, language, transportation, and the lack of representation can often lead to further trauma among communities of color. So we have seen, for instance, some racial microaggressions, discrimination, and xenophobia as well in the mental health care system. So we see as well that cultural incompetence of healthcare providers likely contributes to underdiagnosis and or misdiagnosis of mental illness in Black, Indigenous, and people of color. We also know that stigma of mental illness among BIPOC, it is very strong. It is strongly also attached to the cultural representation, but also the cultural beliefs that some people might have. So for instance, I am Latina. And so in Mexico, sometimes people, they cannot talk openly about their emotions, but they can say, I have a big pain on my chest. Sometimes that big pain in the chest, me duele el pecho. It means that sometimes people cannot breathe. Probably they are also about to have an anxiety attack or something that we don't know the symptoms. So people are also fearful of rejection. So anything that have to be close to any labels that you have depression or also anxiety, can create barriers. So people don't want to be labeled. So people are naming their symptoms differently. Also, cultural representation of symptoms, just as I mentioned before, are some of the many barriers to care that explain errors in the diagnostic process. So now we are turned around and we will start talking specifically about health disparities among historically marginalized graduate and professional students. I'm going to pause a little bit here to see if any of you have any questions or comments. Okay, thank you. So when would you like to share this, or would you like me to share it?
No, I'm happy to talk about this. Not happy because it's an unfortunate subject, but unfortunately, we know that there are high rates of mental illness among graduate students as a whole that are unfortunately also concentrated and intersect with some of these other historically marginalized identities. And so these two instances that are placed on the screen are part of a larger collection of stories about, some of the marginalized colleagues or historically excluded students who have passed on well before their time, either in grad school or shortly after. And, this is something that is unfortunately impacting too many members of our community, and something that we should be mindful of, that there are, this is a widespread cultural phenomenon. It's not unique to the University of California. It's something that we're seeing throughout the graduate student population.
Thank you, Wen. Yes, so I also just would like to expand a little bit on this. So as you can see, this is a piece that Dr. Helen Moore wrote for the American Sociological Association. And just as when mentioned, this professor was, talking about the hurtful and heartbreaking as well passing of gay and or Black graduate students. So as she mentioned, I'm writing this in memory of my marginalized colleagues who died too early. And here is just one example of one of these students, and I'm just going to read it. Again, we will be sharing all the different stories of her students as well, so we can also say their names. So Vanetta Aaron passed away in 1997, was an MA student who was told by medical personnel that her trouble breathing was due to her obesity. Climbing the 7th flights of stairs to our department, she later collapsed and soon after died in hospital from undiagnosed hypertension and heart failure. We established the annual Vanetta Aaron Inequity Paper Award given to a sociology undergraduate so that each year we can say her name. This is also an example of what other professors are doing to recognize and also to not forget their students who have passed away too early. And again, this is, just an example of what other professors are doing to be respectful and to not neglect these stories. And as you can see, she was pointing out undiagnosed. Remember where we have been talking about health inequities? So this is a specific example of why it is important to hear the symptoms of our students and to provide the adequate care. So then, what do we know? Okay.
Sorry. So we do know that higher education as an institution has existed and was really built around the experiences of white middle income or well income abled and cis male perspectives, and those are the perspectives that dominate, even though our graduate student population is becoming more diverse, not quite to the level that our undergraduates are, but this is also advancing. But even with this change in demographics, the higher education system is still a place of white privilege and is often hostile and toxic towards historically marginalized communities. We know, and it's been shown in several different populations, that students who come from low income, who identify as female or BIPOC graduate students experience the greatest mental health burden. And we think that there are a variety of factors that intersect with all of this that are leading to this in these populations. But we are, still thinking about how there may be a place for us to gain an empirical understanding about how these multiply marginalized identities and the social determinants of health are linked to the mental health disparities. And this is really the question that is underpinning most of this project, right? We want to understand how these marginalized, these students who are coming into a somewhat hostile environment that wasn't built with their experiences in mind, and how we can take ownership and think about how we can address some of these mental health disparities among our students. So Evelyn, did you want to add anything?
No, thank you. Thank you so much, Wen. You did great. So now also I would like to talk a little bit about the academic professional life cycle. So I would like you to keep in mind that these are the career stages expected for tenure track faculty who are working or would like to work at research universities in the US. And this is a career, the stages that you can see, for instance, to the left side, it is the first one, it is the liminal stage. So what does it mean, liminal stage? So the liminal stage, it is where most of the professional identity, it is where the professional identity, it's grown a little bit more, or it is grounded in all of us. So what we see, for instance, in this liminal stage, it is that graduate school plays an important role. Graduate school, it is the entrance to the academy. So it is a place where we are socialized by the norms and the practices that others are doing, right? So as you can see here, there are 3 sub steps that everyone must follow. So the first one and have to accomplish. So the first one, it is coursework. So all graduate students are required to complete a specific coursework. In some programs, this coursework could be 1 year or 2 years, depending also on the previous experience of the student or also in the program itself. After the coursework, then grad students are expected to pass their qualifying exams. And then after passing their qualifying exams, then it is expected that they write a dissertation. So in each of these different sub-stages, graduate students are in need of the approval of others, particularly the approval of their advisors or the PI, right? So the decisions that others are making for the students will impact significantly their mental health and well-being. After grad students graduate, so the new doctors, then they start another not so easy stage, which is the job market search, right? So some of them start postdoctoral positions, and many of them suffer because of job rejections. So I'm talking about, remember, this academic professional life cycle. It applies to everyone, regardless of your gender, your race, or ethnicity. And it is expected that in the transitions between each of the stages, academics will encounter different spaces of uncertainty, but also existential crisis. Wondering, am I really want to be in academia? Do I need to go outside academia? You know, this is like the constant also questions that people might have. And as you can see here, it takes between 13 or 18 years since the day that you start grad school to get the dream job, which is like to be an associate professor, to get tenure, right? So we are talking about 13 or 18 years of precarious living conditions. Most of graduate students that are coming from historically marginalized backgrounds, they are suffering even more than those that are not coming from these previous experiences of trauma, neglect, or also oppression. So just please keep in mind what we know about the social determinants of health, what we know about the academic professional development, and also what we know about the current conditions of higher education. Because we are here also to acknowledge all this injustice, but also we are here to remind you that you have the voice and you have the agency as well to share your concern, ask your questions, and also the most importantly is for you to help us to identify better ways for us to address. So what can we do? Who should we contact? All this information is very important, so please keep sharing this with us. And so our current project, which is this one, capacity building, is informed by 2 pilot projects. And we will also be sharing some of the findings of these projects because this project also addressed mental health disparities among historically marginalized graduate and professional students. So one, it is the Photovoice project, and the other, it is the cross-sectional study. So this is the model that we are using in our Engaging the Academy project. So this is a framework that is informed by the lived experiences of graduate and professional students who experience mental health conditions in graduate and professional school. So as you can see, there are 3 systems of disadvantage and oppression that shape the lives of graduate students. One, it is finance, particularly inadequate income. Also, we have the environment that many of them characterize as hostile academic environments, and as well as lack of role identity verification. So not having anyone that validates you as a grad student, or no one who is supporting your ideas as an independent researcher. So these systems of disadvantage and oppression are also creating oppressive psychosocial interactions. So what are some of those examples? So we are here clustering 3. One, it is marginalization. So where can we see, or how can we see marginalization? So it can be seen in the invisibility of the voices of our students, a stereotyping of our students, and also censorship. The other one, it is subordination. Remember also that higher education is a system that it is highly hierarchical and also asymmetrical. So we see these asymmetrical power dynamics and power relationships. And also we see in this exclusion. So we see a lot of grad students isolated themselves, or also many of them are suffering discrimination based on their gender or age, or also race or ethnicity. So we find out that because of these oppressive psychological interactions, graduate and professional students are exposed to high levels of psychological and emotional vulnerability. So what do we mean when we are talking about mental health disparities among these patient populations? So many of them, for instance, have a lack of psychological safety. So it means that they don't feel open to talk, they don't feel open to share concerns because many of them are fearful of retaliation. Also, we see that many grad students and professional students have low self-esteem. Many of them also have higher levels of sense of powerlessness. Also, many of them, and I include myself as well, feel imposter syndrome. I graduated in 2019. I'm also, sorry, I forgot to mention, I'm a first generation Latina. I started learning English when I was 18 years old, so English is not my first language. And most of the time I just feel an imposter. So I think that it is also very important for us to just keep in mind that this is part of a structural vulnerability. So it is not my fault, Evelyn. This imposter syndrome is also a result of multiple barriers that the system is holding against us. And then also we see these mental health disparities in the sense of having a diffuse sense of community. Remember, diffuse sense of community, I don't feel protected. I don't think that my voice can be here. But then also, I don't have anyone that I can reach out for help. And this is especially important when we are just taking back again the high prevalence of mental health conditions, especially depression, anxiety, and then also suicidal ideation. So we have different mental health conditions. And this model, hopefully we can publish soon. Our manuscript has been rejected twice, but we have hope that it is going to be published soon. And so here are, for instance, some of the examples from our Photovoice gallery. And this example speaks about inadequate income. So these participants self-identified as female in social sciences, and this participant chose this name, so it's Jess. Since I entered the program, taking care of my health posed a challenge to me. I lost my exercise routine and my healthy diet. It was hard to buy healthy food on a TA salary of $2,000 when rent was $1,000, not including bills. So picture is an exercise ball. And the next participants, these participants also self-identified as female in the social sciences. And this photo is talking or is speaking about censorship. So she said, I highlight this candle whenever I think of my dad. It kind of helps. It's a nice way to think of the memory, but instead of really sitting with the memory, I light this candle and transfer it away so that I don't have to deal with it. I don't talk about my sadness with anyone, not my sister, my mother, or my partner. I'm not very open to communicating or exposing my vulnerability. I just simply don't have the time to be sad. There is no time to be sad. There is no time to see a therapist because I always feel behind of my readings and assignments. And so if I take the time to work on myself, I will fall further behind to the point where I'm terrified I won't be able to catch up. It sounds irrational, but it's my fear. I cannot afford to be sad. So to provide a little bit more of the context, this participant lost her father during her first year in grad school. So as we can see, it's like there's censorship that you cannot expose yourself. You cannot talk about your emotions because also it seems that there is like a false correlation between open about your emotions or talk about your emotions and then not being professional or not being academic. And then this last participant, also self-identified a female in the social sciences, said, this is my journal where I wrote down all my worries and frustration, grad school related stress. Both my therapist and unofficial graduate mentor recommended this coping strategy to help with my anxiety and depression. So from our cross-sectional survey, so here you can see some of those findings. So after our Photovoice project, we conducted a second pilot project that was more quantitative. And so we developed cross-sectional survey and sent it out. So we received about 120 responses, but just 98 completed, or at least the minimum requirements to be included in our data analysis. So 71% of the participants self-identified as first-generation students, 71% also self-identified as members of historically marginalized communities, 39% included international student, and 47% of the samples identified as English as a foreign language learner. So here are some to the right. You can see some of the findings that talk specifically about living conditions. So for the income, 54% of participants were low income and had a yearly income between $0 to $24,999. About food insecurity, so we find that 11% of participants received government assistance, and 33% received campus assistance, such as food pantry. So whenever you are in the table, when they are making decisions or when they are talking about living conditions of grad students, please remember these numbers. I know there are other different surveys that can also support or serve as an evidence of why it is important to talk about food insecurity among these patient populations. And sadly as well, we find out housing insecurity. So around 7% of participants have been homeless during grad school, with higher occurrences during summer months. So what can we do to support our students during summertime? And so here are also some of the findings that talk more about the prevalence of mental health conditions. So as you can see in this graph, 67% of participants agreed that grad school has negatively affected their mental health. 67. We have that 52% of participants experience mental health conditions during undergraduate education. So our project is also moving beyond grad school and also advocates for more preventive efforts, right? Like, how can we support our students from historically marginalized backgrounds, even when they're in high school? Don't start thinking, in grad school, yeah, of course it is happening, but also how it is that perhaps the prevalence exists when they enter higher education. What are the statistics? What do we know, right? And then also, what can we do to prevent this suffering? We also know that 34% of our samples screen positive for clinical anxiety. And so they have these higher levels during qualifying exams. And I just want to point out that, again, we shared some screening tools, but remember, this is not diagnosis, okay? Because for having a diagnosis, you need to have other steps, and also you have to have the presence of a counselor, a therapist, or also a psychiatrist. So we are just talking about the findings from these screening tools. So 55% of our sample also screen at risk for clinical depression, with high presence during the 3 stages. So we see high prevalence of clinical or students that might be at risk of clinical depression at all stages. So this is very important as well for us to keep these numbers in mind to prevent suffering again. And 31% of participants reported knowing a graduate or professional student who has had suicidal thoughts. And so when we also ask our participants, whether they have had suicidal thoughts, unfortunately, we'd find out that 28% of the participants say that they had suicidal thoughts since they started their program. So this is very important as well, because we didn't ask, have you ever in your life? No, we asked them since you start your graduate and professional program. And so according to the Centers for Disease Control and Prevention, the annual prevalence of suicidal ideation in adults is 4.8 in the Western United States. So the high prevalence of suicidal ideation among historically marginalized graduate and professional students is significantly alarming and must be addressed promptly. So what are some of the barriers? Again, these findings are from our cross-sectional survey, and here are the 4 main barriers that our participants listed. So the first one, it is a stigma on mental illness. So they are fearful of a stigmatization. The second one is they have low mental health literacy. So many participants were questioning the seriousness of their mental health conditions. The third one was fear of diagnosis. And then the last one, it is the lack of understanding of the unique mental health needs among historically marginalized graduate and professional students. So if you haven't had the chance, we invite you as well to watch our research trainings. In these research trainings, we are also have been addressing some of these issues, and we are also helping our stakeholders to increase their awareness, but also their knowledge about all the information that we have been sharing with you today. So now, let's go with Wen again. Thank you, Wen.
Yes, thank you, Evelyn. I think that Evelyn has laid a very compelling case that mental health services for graduate and professional students are highly needed, are absolutely necessary in this population. And so we want to use this lens of social justice and racial equity to ask questions about how and why the norms of higher education have been created, but then also how priorities are set and how decisions are made. And so we're really at a space of asking, what can we do to make this better for our students now and in the future? And so this is what's called the wheel of oppression. This is a way of visualizing where a individual or where a type of population exists relative to the most powerful or most, the individuals within society who are taken the most seriously or have the innate sense of belonging. And so when we are thinking about what that looks like, it generally tends to be, again, younger, able-bodied, middle-class to wealthy white males who come from a Christian background, who are, slim to slender or of normal weights, and then who are, comfortable in the gender that they were assigned at birth, and are cisgendered and heterosexual. And this is a really important consideration as we're thinking about this. We have different aspects of our own identities can place us at different places upon the wheel of oppression. And so even though I am a white female, I am neurodivergent. I am also from a very low income background. I'm a first generation student. My father didn't finish high school. So to be in a position as a PhD student was very daunting for a variety of reasons. And so, using this wheel, we can sort of start to place where and how these different intersections of identity can lead to, distance or proximity from this idea of power and or, safety especially in an environment of higher education.
Yes, thank you, Wen. I also would like to point out to the different levels also of power or privilege that you can see here. It is at the individual, but also cultural, institutional, and then also the systemic level, right? So just as Wen has been mentioning, so those who are at the center have more power. So if any of you are, like, if your identities follow these, structures of power, then we can expect, or we can say that you will have higher privilege than all those that are not following under any of these identities as well.
And so we have this, adaptation of that wheel on this slide. And this is really just sort of thinking about how you might place yourself, or how an individual might feel or fall within that different range of power and oppression. And so this is, again, really helpful to get a visualization of marginalization, and how this might, relate to your experiences within higher education or within seeking mental health care. And so we do have this activity where, if we would all like to participate, I don't believe this is shared with us. You'll only see it yourself if you were going to scan the practice, but you can think about where your different identities fall through these, these different identities that you might have, using the wheel and thinking about, what this looks like for who feels comfortable stating that they're struggling, or who has a support network to turn to, or what all of this looks like for a student who is further from the power center that is within the wheel.
Mm-hmm. Thank you, Wen. And also in this one, as you can see, again, those who are at the center will have more power, but also privilege. And then also you can see here, for instance, those who are at the margin will be marginalized based on this white privilege. And then also, thinking about these structural factors such as colonialism, right? So racism, classism. So as you can see here, for instance, citizenship, being undocumented is like the higher levels of marginalization. Those who are citizens, then they will have more power. So thinking about formal education, right? So what does it mean? So when you are, for instance, right at the power, it's like you are in this post-secondary education. And so what does it mean when you are in grad school or in professional school, right? So although that we might come from poor backgrounds or low income backgrounds, the fact that we are entering this powerful system, which is higher education, it is also enabling and creating some opportunities for us to create some change. Whether we will have opportunities to make change, we don't know, but also remember that collective efforts and collective decisions tend to be stronger than just individual efforts. So this is why we are here. We are trying to build a community that persists, but also that can co-create a new higher education. Some people might be calling this utopia, but I do believe in utopia because the reality is not what I like. and it is also really harmful to many of us. So if you can just please take a time, let's work on this Google. I'm sorry, the wheel. So I shared I shared a wide example of the wheel. Again, you will not be sharing your responses if you don't want to, but if you would like to, we will also be open to hear you. And again, in case you would like to share anything, we are going to stop the video recording, so your voice and experiences will not be included in the video recording. But this is what we would like you to do. So we are just going to follow the steps that are here. Please take a few minutes to fill out the categories below in order to create a map of how the intersecting parts of your identity result in privilege and oppression as well. So the more privileged you are by an aspect of identity, the closer to the center of the wheel your marker will be. So again, we are not comparing our responses, but this is an exercise also of reflexivity, right? This is also an exercise of positionality. Where is our positionality? What are the frames of reference or the biases that we are bringing when we are working, when we are doing our research, when we are criticizing the system? So let's take a couple of minutes so you can place it any way you like. So do any of you have any comments or questions? I saw some comment right now in the chat that someone loves the wheel. So thank you, Anne.
Yeah, I think that this is a really great tool to be able to think through, like, where is your positionality and how does that shape, in the context for me, how does it shape my mentorship approach? How does it shape the things that I say? Or how does it shape how I need to be more critical of my own positionality with my interactions with graduate students?
Thank you. Anyone else would like to share anything so far?
I really appreciate, Evelyn, that you called out the, being part of higher education and that proximity to power. And I think that's important to keep in mind, but it's also something that can create some friction when your other identities are marginalized because you may be the only person in that space. There isn't necessarily someone who, looks like you or has your experiences like you are not the default. And so a lot of times there's just this, whether, intentional or unintentional, this, the expectation that your privilege in this one space will translate into your privilege in other spaces as well, when that's not the reality for a lot of students. And there's a lot of conflict inherent in that, just internally and externally, that can make it challenging.
Yes, and thank you for bringing this up, because this is exactly what we have heard as well from our participants, that they don't know where to belong. So they say, no one tells you that every year you spend more in higher education, you are becoming someone different from your peers, different from your family members. And so like this lack of sense of belonging also, it is another challenge. That yes, of course, we are in this privilege sphere, like it's higher education, but when we are there, no one really listens to us, or no one really validates us there, right? It's like, well, you're here too problematic, you're asked two questions, or you're too woke, and it is not actually welcoming. It is not helping us to probably, create the world that we would like to. But we're here also to remind our students that you are not alone, and also that we are here for you all, and that we would love to keep, hearing about other experiences, and also to make sure is that how is that this project can resonate with you, or also how is that this project can address some of the barriers to access mental health services as well in your programs or in your institutions. And also I see someone raised a hand. And
Yeah, so there were a couple things, but just to build off the current conversation, it reminds me a lot of what you said about liminality. And like in anthropology, we study liminality a lot, and it makes so much sense that graduate students are in the liminal phase because they're no longer how they existed in their family, in their community of origin. They now are in this new community, in this new space, but they're not yet real academics. They're not yet, they don't have their PhD. They haven't yet gotten to the point where they can have a faculty position. So it's this very long period of liminality, and they don't fit in anywhere, right? It's like they're really in this in-between space.
yes, and I think that this is also very common when you are coming from historically marginalized backgrounds, or when you had any traumatic experience in your life, that sometimes when you overcome those things, or when you are in a more privileged background, you feel guilty. Like, why is that I'm here? Why is it like not everyone is here with me? But also just keep in mind that these positions are also helping us to make some changes in the structure, right? So probably don't feel guilty in the sense that you are not like the others, because you are also coming from these backgrounds, right? So it's like you have learned, you have reflected, you are doing things to help students who are, recovering from substance use. Like, you are doing wonderful things with historically marginalized communities. So I think that, again, this will, it is also subject to each of our interpretations. But then also just keep in mind as well that it's very common to hear that people, for instance, first generation students, that they feel guilty, or also the children of undocumented migrants to arrive to the country, then also they feel guilty because, they cannot support their parents. Or like they say, I have to finish this because these are the dreams of my parents. But, if I don't do it, then all their sacrifices are not worth it, right? So it's like, to what extent we are doing this, and also just keep in mind that we are, like, many of our communities have histories of traumatic experiences. So like, how is that we are going to help them to heal? This is also something that I see this as an invitation for us to be able to reflect a little bit about our positionality, and then also have more clear, or at least to start an intentional pathway. So it's like, what is the intentionality of our actions? What is the intentionality of the things that we are doing? What are the voices that we are amplifying? What are the authors that we are sharing with our collaborators, right? But just keep in mind that race, gender, and class, and social class, are among the main social identities that will shape our lived experiences, and also the different oppression that we might encounter in our lives. Here we have a comment that it says, intersections of identity is a great conversation to have in conjunction when discussing positionality. Thank you. Do anyone else would like to share anything else? And also remember, we can also stop the recording at any point. Well, I'm going to. Okay, thank you, everyone. So, well, here is a model that I've been working on, and provide some evidence-based recommendations of how can we better address the mental health disparities in graduate and professional education. So the first thing we must do is address basic needs. address making sure everyone has income that allows to not only to survive, but to feel secure, to have housing, to have food security. Also, we must work on psychological safety. What are we going to do to make sure our students feel that they are being loved, respected, that they are heard, and then also role identity affirmation. What can we do to verify the identity of our students? What can we do to increase the quality but also the relationship with significant others? And in here, I'm talking not only on PhD advisors, but also professors, colleagues, peers. You know, like we have heard that people of color in academia experience discrimination from undergrad students, particularly in white predominantly institutions. Many of them are teaching their students are raising their voices, they are not showing up, and they're expecting to have A. And then also, what can we do to build or to create this community belongingness? What can we do to increase the social connectiveness, to make sure that our students have access to community resources? Also, what can we do to help them to, achieve empowerment and, most important, liberation? How can we help our students to move from these oppressive environments to more empowerment and liberatory practices? So now we have our second and last activity.
Yes. And so I think this goes back to one of the great points that were raised in our discussion, that, when we do have some of these more privileged or dominant identities, how can we think about ways to leverage that privilege to make space for others, for voices, for ideas, and for experiences? And so what we would like to do is think about some of the different examples of what you might do, of how you could use the privilege that you do have to make space for individuals or for graduate and professional students of marginalized identities.
Thank you. Thank you so much for sharing these wonderful ideas. And so now we just have 5 more minutes. So now we would like to have your feedback. So we would like you to take 2 minutes to please respond to this survey. This survey, it is especially important for us because it is in this survey where you will have the opportunity to suggest a topic for future research that focuses on the mental health of historically marginalized graduate and professional students. Also, just remember that your responses are going to be anonymous. So please make sure to click on it, and you can suggest more than one topic. You can just suggest all the topics that you think that would help us to address the mental health needs of historically marginalized graduate and professional students. Okay, so as you are taking the time to the survey, we're also just going to share some of the resources at UCR. So remember that we have counseling and psychological services. There is also Live Health Online, which is $0 copay for behavioral health services for those students who are enrolled with UC-SHIP. Also, we have a Student Disability Resource Center, a Student Affairs Case Management, Campus Advocacy Resources and Education, Student Health Services, and also the WELL. At the national level, we have some of these resources, which is the National Suicide Prevention Lifeline, SAMHSA, as well as the National Alliance on Mental Illness, sorry. So,
And yes, since this is a capacity building project, we do just want to highlight that we are one of many groups that are paying attention to mental health among our student population, and of course, staff and faculty as well. And so there will be a town hall tomorrow night on Zoom it's hosted by UPD with collaboration from UCSA, which is our undergrad student association, and from UAW 2865 and 5810, which are the grad students, postdocs, and academic researcher unions. And so that will be tomorrow night at 7 p.m.
Thank you. And so just please feel free if you have the time and you are interested to join these incredible efforts. So the town hall also will be via Zoom. And also we invite you to attend our upcoming co-learning activities. So on May 8th, we will have our third educational workshop that will focus on setting limits and boundaries. And on May 22nd, we will have our last educational workshop that will focus on building community through story. And in June, we will have our podcast series. So remember that you are not alone, and we are also invite you to visit our website or also follow us on Twitter. And please just keep highlighting the voices of our students and help us to move forward with anything that we can do to address the unmet mental health needs of our students. Thank you so much for your attention. Muchas gracias. So I'm going to pause the presentation, and now we are